Hi Skylar, my name is Tess. I'm going to be your student nurse today. Can I see your wristband and can you state your name and date of birth?
Skylar Nelson, June 22nd, 2000.
Okay, good. So today we're going to do a few assessments. It's going to take a little bit, so just bear with me. I'm just going to first start off with inspecting your head. Okay, so your head is centered, proportional to the body. It's erect without tremors, tics, or unusual movements. Your skull is round without obvious deformities or deformities, and neck muscles are symmetric. So next I'm just going to inspect your facial features for symmetry and size. Okay, so your facial features are symmetrical, proportion, and absent involuntary movements. So now I'm going to inspect your hair for distribution and quantity, texture, and cleanliness. Okay, your hair is evenly distributed across scalp, extending from superior aspect of the forehead to the base of the cranium and the top of the ears bilaterally. So now I'm going to inspect your eyes, pupils, eyelids, iris, eyebrows, eyelashes for shape and symmetry as well. So your pupils, symmetrical, eyelashes, eyebrows. Can you close your eyes for me? Okay. So you have no arrhythmias, or edema and dry skin. You have no ptosis. Your conjunctiva is pink. Your lens is clear. Your sclera is white, and no masses are present. So now I'm going to inspect the neck. So I'm just going to look at your neck muscles and your sternocleidomastoid muscle, your thyroid gland, and your aortic isthmus. Can you just turn your head to the one side for me so I can see your sternocleidomastoid? Thank you. Okay. And I'm going to ask for you to sip of water so I can see your thyroid and trachea move. Okay. So your trachea is midline, a slight symmetric elevation, which is normal, in the mid-neck, and then your thyroid and trachea move together when swallowed.
Here's what I found.
Oh my god, that scared me. So next I'm going to inspect your cervical spine from all sides. So can you just stand up for me while I check? Move your hair. Thank you. Okay. Your cervical spine is concaved and straight aligned, which is normal. You can sit back down now. So next I'm going to palpate your temporal artery to feel a pulse. Okay, so your temporal artery pulse is about like a 2+ out of 4+, which is normal. And now I'll palpate your temporal mandibular joint, which is your jaw joint. And can you open and close your mouth and then move it side to side? Good. So it moves smoothly without difficulty, and I didn't feel any clicks or pops bilaterally. Now I'm going to palpate the scalp again. Just feeling for any bumps or lesions. Okay. So your scalp is symmetric without tenderness, masses, or lesions, or differences in firmness. There's no bulging or depression of skull. So now I'm going to palpate your thyroid. So can you tilt your head slightly back for me so I can palpate? Okay. And now I'm going to palpate from the back side. And can you move your head? Thank you. Okay. So your thyroid is not palpable, and it's barely palpable underneath the sternocleidomastoid, which is normal. And finally, for this part, we're gonna do the neck range of motion. So can you touch your chin to your neck for me? And that's your flexion. Good. And can you look upwards to the ceiling? Good. That's your hyperextension. And can you touch ear to shoulder? Good. That's your lateral flexion. And then can you turn your chin to shoulder for rotation? Good. So you have full range of motion in your neck. Now we're gonna get to your lymph nodes. I'm just gonna feel around to see if I can feel any bumps or anything. So I'm gonna start off with your preauricular, which is in front of your ear. And I'm gonna do in circular motions. Okay? And now I'm gonna do your posterior auricular. Okay? And now I'm gonna do your occipital, which is in the back of your head. Sorry, my hands are cold. Okay, and now I'm gonna do your tonsillar, which is like right here. I don't know how else to describe that. Okay, and then your submandibular, which is in like the back of your chin. Okay, and now I'm gonna do your submental, which is like right here in the top of your chin. Okay, and now I'm going to do your superficial cervical, which is right next to your sternocleidomastoid. So on both sides. And can you turn your neck the other way for me? Okay. Now I'm going to do your posterior cervical. Oh, it's like down here. Okay, and now I'm going to do your deep cervical, which is like lower. Okay. And now I'm going to do your last one, which is your supraclavicular, which is in that groove in your neck. Okay, good. So I didn't feel any, it was non-palpable, I didn't feel any bumps, so that's a good thing. Now I'm going to go to your mouth and your pharynx, so I'm just going to inspect your lips. And afterwards, can you just stick out your tongue for me then? So your lips are good, pink, moist with no lesions. And now can you stick out your tongue? I'm gonna grab my pen light. And I'm just gonna inspect all sides. Okay. So tongue is pink, smooth, midline, no tumors or lesions are present. Now I'm going to inspect your uvula, your teeth, and your gums. So can you open and say ah for me? Okay. I'm just gonna inspect your teeth and your gums. Okay. So for your uvula, it rises symmetrically. Your teeth, there's 32 intact, it's non-tender. Inspect the gums. I didn't, so it's pink, firmly adhered to teeth, moist without bleeding and inflammation. So now I'm going to inspect your hard and soft palates, which is on the roof of your mouth. So can you just open for me? Okay. And your palate is smooth and pink and intact. Your Wharton ducts, so can you just lift your tongue for me so I can just see below where you have saliva? You have to like open, like, okay. Ducts are smooth without inflammation. Your saliva is present. It's moist and dimples noted bilaterally. And I've already inspected your mucosa while checking your mouth, which is pink and moist, no lesions. And now I'm just going to inspect your tonsils and your posterior pharyngeal wall. So I'm just going to open your mouth and say ah so I can see the back. Okay. Your tissue is pink, moist, with symmetrical margins, no enlargement or lesions noted. Your tonsils are absent. And for your posterior pharyngeal wall, it's pink, moist, and symmetrical. So now we're going to go to your nose. I'm just going to inspect the outside of it. Okay, your nose appears symmetrical, midline, and proportionate, shape to facial features. Your skin surface is smooth without lesions, and your coloration is consistent with the other facial complexion. Now I'm just going to palpate it. So I'm just going to feel around. Okay. What is that word?
Pain.
Oh, there seems to be no pain, tenderness, or break in contour. And next we're just going to check your nasal patency. So can you close off one nose or one nostril and just blow out, and then do the same on the other side. Okay, you can patent bilaterally. And now I'm just going to check inside your nose. So I'm just going to have a pen light and look up inside your nose. Okay, so your septum is midline, your mucosa is pink with no prominent blood vessels or crusts, and a small amount of drainage is clear. So now I'm going to assess your nasal airflow. So can you just breathe out while keeping your mouth closed? Okay. Your airflows around normal nasal structures is adequate. Overall, there's no evidence of polyps or abnormalities bilaterally. So now I'm going to do your sinuses. I'm going to start off by just inspecting them with your frontal, maxillary, and your ethmoid and sphenoid. Okay. Sinus areas are symmetrical with no redness or swelling bilaterally. So now I'm just going to do the same, but palpate and percuss your sinuses. So I'm just going to feel around with your frontal, your ethmoid and sphenoid, and then your maxillary. Okay, so there's no redness or swelling bilaterally, and they're symmetrical. Now I'm going to no tenderness or fullness is present bilaterally. And then finally, I'm just going to do your transillumination. So I'm just going to use the pen light again and put it over your sinuses to see if there's any abnormalities present. Starting off with the frontal. Okay, and then I'm just going to go to your sphenoid ethmoid. And then finally I'm going to do your maxillary. Okay, there's no abnormalities and your sinuses are fully illuminated bilaterally. And that's the end of your assessment, Skylar. Thank you so much.
Thank you.
And I'll see you later.
Okay.